Hi ladies! So today I'm 31 weeks pregnant. It feels crazy to say that I'm that pregnant already, but I am. I'll let you know kind of what happened last week. So we started off the week on Wednesday. We went in for my 30-week appointment and my ultrasound to check the baby's kidneys. And since I haven't talked about the kidneys for a while, when we had our 20-week scan, both of the baby's kidneys were enlarged, dilated, what they call it. And that's abnormal, but it's seen frequently, especially in boys, and this baby is a boy. So I've had a lot of ultrasounds just monitoring the size of the kidneys and things like that. And so I had another ultrasound to see how that was going. And this ultrasound had the same exact results as the last ultrasound that I had when I went to maternal fetal medicine like 6 weeks ago. And so the baby's right kidney is measuring 4.2 millimeters, and the baby's left kidney is measuring 6.8 millimeters. Anything over 4 is considered dilated, except a perinatologist doesn't say anything is wrong until it's over 5, but it can be 10 or 12. So they're classifying this as a stable, mild case of kidney dilation, and they're saying it's stable because it's unchanged since the last ultrasound, and it's mild because it's only slightly, one's actually below 5 and one is above 5. So since the first time we found it, that there was dilation, one kidney got better and one kidney got worse, but since the last ultrasound that we had, it's exactly the same. It's unchanged. So it's not getting more dilated. It's not changing now. So the course of treatment right now is basically we're done kind of waiting and seeing and watching. It's classified now as stable and mild. And so there will be follow-up when the baby is born. The baby will have to have an ultrasound of his kidneys when he's born. And then our pediatrician is actually a family member. So I saw him this Sunday just at a family function. And he asked, how the baby is doing. And I told him the most recent results of the ultrasound, and he said, don't worry, and he didn't feel like it was a rush that we had to get the ultrasound right away. He said, in the first few weeks, we want to do it, and then usually the treatment options are either going to be surgery or daily antibiotics for the first year. And I told him how daily antibiotics really freaks me out because it interferes with the immune system. It kills not only the good bacteria, or not only the bad bacteria, but also the good bacteria, and that is worrisome for me because I feel like it majorly interferes with the immune system of a person from the very beginning. And he said, since it's mild, he goes, I don't like the idea of antibiotics either, and I don't think it's going to be a severe enough case where you need surgery. So it might just be more well checks, more diligent about taking the baby's temperature, and regular urine screenings to make sure there are no bladder or kidney infections. Because the thing is, the baby can't tell you it has a kidney infection, right? So just staying on top of it and watching for signs of infection, and then treating rather than pre-treating anything that might happen. And usually the complication, as long as everything is structurally normal, is just an increased frequency in bladder and kidney infections. And a lot of babies like outgrow this in the first year. A lot of babies outgrow it in the womb. So we're going to talk more and obviously wait until we see what the ultrasound says and make sure it's still classified as mild. But that we're just going to hopefully take a more proactive approach in monitoring for infection rather than treating a possible infection. So that's kind of where we are with the baby's kidneys. So other results of the ultrasound, he's measuring 4 days ahead, and this was at 30 weeks and 2 days. So he was measuring 30 weeks and 6 days. And then he was measuring 3 pounds and 6 ounces. So he is, growing right how he should be. So that was good. Is good. And then other pregnancy things, I've started noticing swelling, like mostly from like my ankles to my knee, gets really swollen, especially when I'm working like sitting. If I sit on like the couch and put my feet up, they don't get swollen. But if they're like dangling down from a chair, they do. And then usually when I wake up, it's gone. It's not like a persistent swelling, but it is present now most days by the end of the day. And I have been rubbing a little lemon oil on my legs. That seems to really help the swelling go down dramatically and quickly after I'm able to rest. So notice that. I had a couple of days this past week where I just had a lot of contractions, like a lot. And it's normal for me. In my last pregnancies, they've termed it an irritable uterus, like any types of stimulation, whether my bladder is full or I'm walking or the baby kicks a certain way, will trigger me to have a contraction. And they're not really painful, but they're like really pressureful. So they are uncomfortable, and like I can walk through them when they happen, but I have to slow down for sure when they hit me. And drinking water does seem to reduce their frequency, but I stay pretty well hydrated regularly, so I have to stay extra hydrated, I guess. And I was having so many that I actually got out like our hospital bags and started throwing some things in there. Not that I thought we were going to go into labor, but like I'd rather have some stuff ready because I have to pack for my husband and I for the hospital. I have to pack bags for my kids to go wherever they're going to be going. Hopefully someone is able to come to our house, but you never know. Like, just depends on who's where and, what time things happen. So I did start getting things together. My bags are in no way packed, but I'm starting to get a list. I'm starting to set some things aside that I know are for specific either labor or hospital or the kids. And also some of the labor things that I'm packing, I can pull out when I'm having those episodes of lots of contractions that they're just comfort things. So it's nice to have them in one place. So I will show you those bags once they're packed, but they won't be packed for a while, just the starts of things. The kicks are getting really strong this week, and yesterday, the day before yesterday, the baby was really quiet again. It had a really quiet day. Got the Doppler out. The heart rate was like exactly where it's been every time we've seen the baby lately. So I wasn't worried about him. It's just something, I don't know if a lot of babies do this, but my babies do this. They'll just have a random quiet day or two. And then when they come out of that, then they're super active, and I think they just rest and grow, and then they wake up. I just think that's how my babies are. So yeah, we had another, I'll call it a growth spurt this week, I think. And the kicks are getting really strong, and it feels like he's trying to come out of my belly button. Like, I feel so many kicks and rolls and punches there. And it's probably because my muscles might be like separated there a little, and I can just feel it easier because he's closer to the surface there. But I'm really noticing that. And I've had some heartburn. And it can be like I drink a glass of water and I have heartburn. It's not like what I'm eating, it's just present. And it's mostly happens at night. And I don't know, that's not been a symptom I've really had in other pregnancies. So that's interesting. And they say, you know what, if you have heartburn, your baby's going to have hair when it's born. And my other babies had a head full of hair, and I had no heartburn. So I'm wondering if this baby is not going to have hair, like kind of the opposite of what people traditionally say. I don't know. But I'll be interested to see about that. And one thing I have also noticed is when I lay down at night, if I lay on my left side, I get really nauseous. And your stomach is on your left side. And I feel like if I lay on my left side, the baby like falls on my stomach and kicks it and is like pushing all the contents of my stomach around, and it makes me really nauseous. And so I know you're supposed to sleep on your left side because that's the optimal position for good blood flow, but I can't. As soon as I do it, I start feeling sick. And so I either have to kind of like lay on my back propped up a little or on my right side to get him off of my stomach, at least until it's empty. Like later in the night, I can roll on my left side when the food has gone through my stomach already. And it's not as big of a deal, but like if I've eaten anything and I lay on my left side, I'm going to feel sick. That's what I've noticed. So I've learned to avoid that. And that is my pregnancy symptoms for the week. Actually, Thursday I went in and worked and trained with this company I used to work for, and they've got me all trained and set up for this work I can do at home now. So I started that, and I worked a lot this past weekend for them, and I'm still doing my other work at home work, so I'm trying to just get a lot of work done now so we can save up for when the baby comes, because I will be kind of slowing down my workload at that point in time until the baby is sleeping and I'm able to pick back up to the level of work I'm doing now. But yeah, so that's been fun and interesting. I like working. I like being home with my kids, but I do like to have this work I can do at home. It just keeps my mind like stimulated, and it keeps me up with the clinical skills. I'm a RPSGT, which is a registered polysomnographic technologist, and I am able and allowed to run sleep studies in a sleep center and score the sleep studies and start interps for the doctors and things like that. So that's what I do at home. I don't work with the physical patients, but people who have sleep studies at home or in a lab where the techs don't score, the studies get sent to me and I score them and then kind of summarize what I saw and send it back to the doctor. So I really enjoy that kind of mental mommy break where I get to use my brain for other purposes. So, yep, that's what I've been doing. And one of my friends had her baby on Sunday, yesterday morning. It's her fourth, and she lives really close to me, and so I'm super excited to go see the baby and all of that, and hopefully my kids will get excited seeing the little baby too. So yeah, that is the happenings of the week. I will show you my belly, and then next week, flipping through my calendar here, the end of next week I have sorry, I just got a text from work. I have my 32-week appointment, but I'll almost be 33 weeks. And then also, the bed nest that I ordered is going to be delivered, and we have our hospital tour. So next week is looking fun, and then all of my weekends from now until like the baby is here have been filling up quickly with things to do, like my baby sprinkle and finishing shopping and my brother's graduation party and doula appointments and maternity pictures, and I have a feeling these last few weeks are going to fly by. So it's exciting because then he'll be here. So all right, well, I think that's it for this week. I'll show you my belly, and I will see you ladies next week. All right, here's the belly. It's from the side, from the front, and the other side. So there he is. All right, thanks for watching, and I will see you next week. Bye.